In the Pacific, geographical access is an issue, and that sits well within the movement that we have on universal access to reproductive health. And over the last 2 or 3 decades, the work we've been doing with UNFPA, the countries, WHO, is that to begin with, you have a gross shortage of pharmacists in the region.
We're aware that within pharmacy services across the Pacific, the majority of posts are filled by non-professional staff, pharmacy assistants, pharmacy technicians. And we feel that this particular education product is filling a gap, providing the skills and competencies needed for the people that look after the vast majority of these services across the Pacific. So we think from our trial it's shown that it works well, it is useful. We think the future lies in looking at how to sustainably transfer this course to countries around the Pacific so they can use it into the future to help skill up the base level of staff needed to provide their pharmacy services.
Before we roll this out to your countries, you need to ensure that it's properly contextualized to suit your country.
From this training, I know where I stand now. Before, just leaving the high school, I just joined the workforce. There was no such training before, and I just did a little, just a 1 week or 2 week training with just under one supervisor, and it was only manually. Just told me to do this, I just do that. I don't know the details of it. Now I am just more confident and I can do all the stuff myself. I know what is the start of it and what's the end of it.
After attachment, we were thrown to the subdivision and I was working alone. Most of the times I have to ask the doctors and call the pharmacist back. But now after the course, with the knowledge, I don't have to do that anymore. I just answer straight to the patients about the drug usage, what type of drug that they are taking, and even with my stock management, it's now a better storeroom as compared to before. I'm managing stock because from the course I learned that those are the taxpayers' money, and it's important to look after them, to keep good records of them. So the course is it has a lot of quality assurance activities, and I really like it and recommend it for other pharmacy assistants to attend.
From this course that I took for a year, it really helped me to know most of the things that was going on in pharmacy work, like not only pharmacy work, like the legislation and the things that we do, like stock taking, that wasn't what I was taught in school.
These participants have already done 10 months of work on their own, and they've done 1 week of training with the University of Canberra already face-to-face. So this is the last leg of it, last phase of it, and what I've seen so far has just been fantastic. I can really see that the participants have learned a lot, and they can really go back and contribute to their working environment. They've learned so many different skills, like doing stocks, trying to forecast what they're going to need in terms of what medicines and how much over the next few months, and they can do really good orders now, so we can really bring down the situation in the country of stockouts.
Well, this course is like will raise the standard of all the pharmacy assistants. They'll be recognized now, and then now we are more confident in our working stations. We can work independently without supervision, and we have a broader knowledge of everything, like the systems, how to consult patients better, and the ordering, proper way of ordering stocks, and follow up.
Some of the things I'm going to implement at my place is the procurement procedures, the policies and procedures that is being followed while procuring stock, the pre-packing strategies, and to become a good civil servant and serve my customers in an appropriate manner, effective and be efficient to reflect our mission and vision for Ministry of Health.
This training is very practical, and I see that if it can include Kiribati, it will be very good, because this is actually gonna improve the competency of pharmacy assistants in terms of their professionalism and their their work performance. So I really encourage that this training is expanded to Kiribati so that the pharmacy services is improved in terms of supply management.
And so we hope these guys can be the backbone of the health supply system, provide that leadership and the whole governance systems that will ensure supply management systems perform can be realized with this group of people. So we think this critical mass of people will be able to assist the pharmacy work in the countries.
This course contributes to the ground level staff. Of course, skilling up the ground level staff will have an impact overall towards the healthcare system. Sometimes capacity building also has to go hand in hand with changing the systems. And I think this is where the workshop is really working, because we've also got people who are the policymakers and people who are in the managerial position who can sort of see what's happening, see the problems at the ground level, and hopefully work together to come up with better solutions for the country.
We're very committed to this work in the region. We think that long term it should be that these problems of stock out, that's largely plagued the system, would be a thing of the past. And the idea is, if we're able to strengthen these little things, they are very basic things, but I think it's so crucial to achieving this universal access, particularly with the movement of work in universal access to reproductive health.